Thank you, everyone, for taking the time today to attend this webinar, and thanks to Ina and ALD Kinect for giving me the opportunity to present to you today. My name is Ben Torres, and I work for a company called Reflexion Health. And what I'd like to do today is kind of give you a little overview of our company and tell you a little bit more about what we've been working on. But before I do that, I have to read this disclaimer out loud to you, so bear with me for just 1 second. The information and services provided by ALD Kinect and Reflexion Health are for informational purposes only. The information and services are not intended to be substitutes for professional medical advice, diagnosis, or treatment. If you or a family member are ill or suspect that you or a family member are ill, seek professional medical attention immediately. ALD Kinect and Reflexion Health does not recommend or endorse any specific physicians, treatments, procedures, or products, even though they may be mentioned on this site. Please note that your participation in this webinar is completely voluntary and that this webinar will be recorded and may be available for rebroadcast at a later time. So that being said, what we'll do, just to give you a quick overview, is we'll talk a little bit about Reflexion Health. I will introduce to you Vera, which is our tele-rehab platform. Give you a quick demonstration of how Vera works, and as well give you kind of a status as to where we're at as a company, and answer any questions or concerns that you all may have. So let's get started. So Reflexion Health, just a little bit about us. We are a digital medicine startup. We're based in San Diego, and we've been around for about 3.5 years, and we spent pretty much two and a half of those years in mostly product development and coming up with the concept. And our goal basically is to focus on meaningful patient-centered care. And basically what that means, just to kind of put it in the correct context, is healthcare is changing dramatically. It's changing quite a bit, primarily in terms of how care is delivered to patients. And that goes across pretty much the entire healthcare landscape. And now what we're noticing is that hospitals, healthcare practices, physicians, other clinicians are now being held accountable, much more accountable for the type of care that they deliver to their patients. And basically the question that they're being asked is, is how can they deliver a much more efficient healthcare to patients? But at the same time, while they make their care more efficient, can they still deliver a good outcome? And so these hospitals and these practices are now focusing on increasing patient engagement, trying to get the patient much more involved in their healthcare, in their decision making, and so that's where the term meaningful patient-centered care comes from, and that's where we come in. So what we've done is we've focused more on the post-acute care space, in particular with physical therapy, primarily because with physical therapy, there's a lot in the post-acute care space. There's quite a bit of cost variability that exists there. And so what hospitals and what practices are trying to do now is trying to get patients to engage with their physical therapy much more. And so what we've done is we've developed Vera, which is a tele-rehabilitation platform for patients. And basically what that does, in a nutshell, is it's a piece of software that guides patients through their physical therapy while they're in the home. And it gathers data and it sends it to the clinician so the clinician can have a better insight. And by clinician, I mean more of the physical therapist. It gives the physical therapist more insight into how effective the patient is responding to their physical therapy treatment or to their home exercise program while they're in the home. And so the way we've done that is we have two applications. The first one here is the Vera Home model, which you can see here. This is a prototype model. If you can see the little Pelican case, as well as the camera that you see up there. This Vera Home unit gets installed into the patient's home when after the therapist or after the physician prescribes it for their patient. It gets installed into the home, and we install it. It's an all-in-one case, and what we use is the Microsoft Kinect camera. It's a motion tracking camera, and what it does is it measures motion of about 22 joints in a three-dimensional space. What it also does is it records video of the patient doing exercises in the home. And it also counts the repetitions and gives them some real-time feedback. One thing to note about this Vera Home unit is that it's all-in-one. So if a physician or a therapist prescribes this for you, we would coordinate with you, install it into your home as long as there's appropriate exercise space and a plug in the wall, and it comes in with its own internet as well. So if you don't have any internet, if you want to use your own Wi-Fi or if you have your own connection, we can do that. But if not, that's okay too, because we provide a wireless access point or a 4G card basically in that kit, so you don't have to really worry about any of that. And then this is what the Vera Therapist will see. So what they will get access to is they will get access to how adherent you are being to the exercise program, and they'll also see how well you're actually doing those exercises. And in traditional physical therapy, you know, the therapist may see you 1, 2, maybe 3 times a week in person, but then they don't necessarily know what is going on when you're at home or when they're not with you. And you know, and so if they only see you once or twice a week, there's still 5 days or so where they need to, you know, where they're relying on you to pretty much tell them how you're doing. Whereas with this thing, with the Vera unit, they actually get objective insights into how well you're doing at home. And so with this they can prescribe the exercises. They can set exercises, reps, sets, and frequency whenever they want from a remote location. They don't have to be with you in person to do that. And then they can also dig in to see the detailed statistics of each individual patient. So if you're having trouble with it, they can also watch recorded video and so forth. And so one of the biggest benefits to the patient here is that it delivers a form of what we call a concierge rehab for the patient. And so with this system installed into the home, what it also has, in addition to the clinician having this objective insight into how well you're doing at home, it also has an enabled teleconferencing capability. So if you can just imagine kind of a Skype for healthcare, that's another feature that we have, so that you can also engage or interact with your physical therapist by video conference when you're at home, and if the physical therapist is at the clinic, and you two can interact and can communicate, and the therapist can check in with you real time and see how well you're doing. And so it's much more convenient for the patient. You know, if they're doing okay and they don't necessarily have to go into the clinic and have to arrange travel with a family member or something like that. And so that's one of the biggest benefits that we've provided. And another one is also is for the patient to know that they're having, you know, that they can take comfort in the fact that their therapist knows exactly what's going on in the home. And so this is just an example workflow of how this would work. We typically have been working primarily in the hip and knee replacement population right now. So and that protocol is much more is pretty standardized. And so the way it will work is the physician or the clinic or the therapist would identify the patient, and then the patient would then interact with their therapist. They would do like an initial evaluation, and they would go over the care plan together and exactly how this would work with the patient, how the video conference would work, how they would interact with the exercises, how they would do the exercises, and go through all that. And then once that's done, they go through a home installation. That's where we come in. We coordinate with you and install the system to your home, and then you can do prehab. The prehab part is primarily if you need to have a surgery or anything like that. And then after surgery you would go straight home, and then from there you just start the home rehab. And then you can do weekly virtual visits with your therapist. That's typically how the protocol has been, where the therapist will check in with the patient once a week or so, and then just to see how well they're doing. And that's in addition to the visits the in-person visits as well. And then at discharge, when the therapist is done, the therapist just has to discharge it, and then we would go in and we would pick up the unit from your home. And so here's just an example of some data that we've gathered. I know primarily the biggest thing to note here is on the adherence and episode part. We've noticed that this is with about 150 patients, their adherence rate has been demonstrated to be 75%. 75% adherence rate, which is a pretty big deal to us, because typically most of the adherence rates that are reported to a physical therapist or to a clinician, a lot of it is first off subjective, and a lot of it is also much lower than that. So it can be anywhere from 14 to even 25% adherence. So with this system here, the therapist is held accountable and also the patient is held accountable, because now we provide you with objective data as to how adherent they're being. And that's through the video recordings, and that's also through the objective data with the counting of repetitions that we'll show you in just a little bit here. So I know that a lot of times when you implement new technology with a patient that may not be completely comfortable with technology, that apprehension can arise. But this is here as a result from an SUS, which is a system usability score that we had patients fill out, and basically it showed that in the 90th percentile, the satisfaction with Vera. So it's actually we've worked very hard to make our system easy to use for someone who may not be comfortable using technology, because they don't, even though it's technology, it's still a rehab tool that we teach you how to use, and you don't even really have to use a keyboard. You only have to use, you may have to do that just a couple times. And here are a couple testimonials that we've had from patients. I think the second testimonial there is kind of is one that we're pretty that we really like. That's where Vera and I would do them together. So I would look forward to seeing her. She removes the boring, tedious time spent alone counting number of reps, especially for someone not so terribly disciplined. And so that's a big deal to us, because a lot of these exercises that the therapist prescribes, yeah, they can be, they can either be really complicated to do on their own, or they can also be very, very boring, especially if you do them on your own. Whereas, because if you just have a paper handout to follow, you're not really engaging in anything. You have to rely on yourself to just, to do everything on your own. Whereas with our system, you actually have a digital coach that will guide you and show you how to do it when the therapist is not around. So let's go ahead and let's go into a Vera demonstration here. Oops. So what I'll do first is I'll show you what you as the patient would see. And so what I have here is the kiosk model, so I have to manually enter in the password, but if this is in the patient's home, you can actually save the password, and all you have to do is just hit the login there. And the screen is also touch screen, so you can use your fingers as well just to kind of touch the screen. You don't need to use a mouse or anything like that. Okay, so I am actually standing about 6 feet away from the camera, from the system, and if you can see that orange hand there, that's me navigating the screen. So I'm just using my right hand to navigate the screen here. And then here you can see the number of sessions. I prescribed myself 20 sessions. That's a little out of the ordinary, but that's what I use for my demonstrations. It also shows my completion rate that refers to adherence as well as accuracy, how well you're doing the exercise. So if I hover over a button here, start exercise, if I kind of bring that hand over here.
This works out your core, glutes, and quads.
Let me pause that for a second. So it goes straight into your exercise plan, and this exercise plan is still prescribed by your physical therapist. So whichever, so you can only do what the physical therapist is prescribing you here. And every exercise has a tutorial. So I'll go ahead and I'll let this one play.
Start with your legs shoulder width apart. Now lower yourself down, like you're going to sit in a chair. Go as low as you comfortably can. Stand back up. Make sure your knees do not collapse inward or go over your toes. Repeat for the prescribed number of repetitions. Go ahead and try it yourself now.
Okay, then after the tutorial, and you can skip this tutorial as you get more comfortable. So it's going to try and calibrate you. So it says here, please move backward. So if you see that orange silhouette, that's me. So if I'm going to move back here just a little bit, once you see that silhouette turn green, it will go right into the exercise scene. And so that lady that you see there to the left, to your left, that's Vera. That is our digital coach. And she will demonstrate the exercise for you, how it's supposed to be performed. And then the instructions for you to follow are at the bottom there where it says squat down, stand back up. So if you can see, if I bring my feet close together, it'll tell me, begin with your legs shoulder width apart. So okay, so I'll go ahead and I'll do that. And it says squat down and stand up. So as I do that, you can see it counts the repetition for me. And so you as the patient don't have to worry about that part. It'll just count the repetitions for you. Now if I do it a little bit incorrectly, it'll kind of give me some real-time feedback. So here it says keep your knees behind your toes. All right, so okay, so I'll do that just a little bit. Okay, and what it's also doing is it's recording video of me doing the exercise, and it's also documenting every single rep that has this real-time feedback. Now, if I'm having, if I'm a patient, if I'm having any difficulty, if I'm having any pain, if I'm feeling pretty tired, what I can do is I can just raise my arm out to the side here, let that bar fill up, and that will pause the exercise. And so I have a couple options here. I can take a couple minutes here to relax for a little bit, and then I can continue where I left off. If I wanted to skip the exercise and go on to the next one, I can do that as well. If I'm having any pain, I can report pain too. So if I hover over that, it's on a scale of 1 to 10. But let's say for this one, I'm reporting a level 3. And then once I confirm that, that level 3 out of 10 will get sent up for the clinician to see. So when they log into their portal, they'll be able to know that with deep squat at this rep on this day and time that you reported a pain level of 3 out of 10. Right? And it says here to use your own judgment whether or not to continue with your therapy or if it's an emergency, call 911. Right? And so then I will go ahead and I will skip this exercise. Okay, and then it'll kind of tell me how many reps I did, how many sets I did, and how well I did it. And then when you're done, I'll go ahead, for the sake of your time, I'll go ahead and I'll end the session here. Okay, and it'll give me a summary, and it'll tell me to come back for however many more sessions I need to, and then and then from there, the patient can just go about the rest of their day. After a few minutes, the monitor will just turn off by itself, and then when they're ready to start up again, they just have to tap the screen twice, and then they can start back up again. So it's really pretty simple. I only have to use the keyboard one time just to enter in the password, but if you were a patient, if you had this in your home, you can save that password on there as well. So it's just all you have to do is just press a button. Okay, so let me show you briefly what the therapist would see on their end. So if I log in here, they would see a list of patients, and then they would get an overview of of how each patient is doing. So if I go in here to Ben Torres, it'll dive right in, and it'll show me kind of the episode summary of how well they've been doing up to date, up to today. So you can see here 12%. I haven't been doing that well, although my accuracy scores are pretty good though, are pretty decent. So let me go. Let me see how he's been doing for the week. All right. So then the therapist can see. We'll be able to see that for this week, what days I logged in to do the exercises, what days I didn't, and how well I did, and how I did each exercise. So the blue refers to the adherence, the purple refers to the accuracy, and we determine these numbers based off the actual repetitions that are documented. So we don't just factor in whether or not you as the patient log in. That's not enough. You have to actually attempt to do the exercise and to do the reps prescribed. and to do it correctly. And so that's how we're able to provide this objective data for the therapist. And then if they wanted to, they can go into deep squat here, right? And then this was me just now. So they can also watch the video of you doing the exercise if they wanted to, but then they can also see here every single repetition that you did, and any repetition that had some type of feedback associated with it. All right? So I can see, so you can see here that I didn't do so well on the I had about two pieces of feedback here on 2 reps, which isn't bad. But you know what? I want to edit the plan. So all I have to do here is if I want to add more exercises, I can do that. So I'm going to add an alternating deep lunge. And then, but I want that lunge to be first, so I'm just going to reorder that, put that up here, and then I can set the sets and reps however much I want as a therapist. And then once I apply that program, once I apply that treatment, the next time you log in as the patient, they're going to see an updated plan. So it's really that simple. And that's that's pretty much it. Let me see. Just to give you a little bit here about how the program pricing works. I'm sure that's a question to be asked. So the pricing varies, and it depends on the method of care delivery. Okay, so usually depending on the condition that we're working with, and depending on the hospital that we're working with, sometimes it is episode based, and that basically means if it's a specific condition that has a start and a finish, we'll price it based on that, and that's what we call episode. Another one is a kiosk-based model, where if it were to be in a clinic or in a hospital where it's just parked there for everyone to use, that's one way. Another one is it's also dependent upon the actual setting, whether you're in outpatient physical therapy, whether you're in home health, or you're in skilled nursing, or if you're doing fall prevention, because we also do that as well. But generally, if it's on a per patient episode basis, it's $750 per patient episode, and that's typically what we've done for joint replacements. But we bill the hospital or the entity that's involved directly, so we do not transact directly with the patients, not at this time anyway. So the patient's insurance is usually not billed or anything like that. This becomes part of the hospital's rehab tools that they use to treat their patients. And so what we're up to, currently where we're at, as I've mentioned a couple times earlier, is right now we are focused on the hip and knee joint replacement populations as well as fall prevention. That's kind of what we focused on right now, because primarily, as I mentioned earlier, with the transition with the transitions in healthcare, where hospitals are being much more accountable for the costs of care that they deliver, they hip and knee joint replacements are what we're starting with right now, and what hospitals are also focusing now as well. But that will slowly but surely expand to other conditions. We're currently working with the Cleveland Clinic and Cleveland Clinic Lorraine Institute. That's not the downtown one. This is a subsidiary of it. And we're also working with Brooks Rehabilitation in Jacksonville, Florida. And we're also deploying fall prevention programs at senior centers in San Diego and North Carolina. And we are also working to continue to improve our Vera product. So that means we're working on incorporating Spanish versions of it, adding more exercises and things like that. And then one of the things that we're focused on now, since I mentioned earlier that the first two years or so we've been focused on product development. Now we're looking to expand commercially. We're about to start a really large clinical trial for about 400 plus patients, to really prove this concept. We're also redesigning the actual home unit, so that case that you saw with the camera and the monitor, that one is our prototype that we've been deploying with patients. And what we're trying to do now is trying to make that thing look prettier. And then we're also exploring other applications as well, such as a mobile application for an iPad or for a phone, other motion capturing technologies, and other applications as well. And that's pretty much it. So, any questions? There. So is Vera only for adults, or can it be adapted to pediatric uses? That's a great question. Right now our exercise. So one is it depends on the type of pediatric exercises that you're looking for. So right now we have about 68 exercises that are all primarily lower extremity in nature, with a couple of balance exercises. And a lot of those exercises are pretty they're pretty basic exercises, and so which can basically be applied to many uses, where it's not just where it's, for us, it's not just joint replacement, but it can also be any exercise that involves a lower extremity. So yes, it's definitely possible, but it depends on what you're looking for. As I said, they're all primarily basic. Okay, so I got another one here. What is the cost? Is the unit just rented, or does the patient buy it? So as I mentioned earlier, right now we transact directly with the hospital or the healthcare provider. We do not bill the patient directly, and we do not involve the patient's insurance. And so this is something that the hospital or the entity that's involved would have to take on, and they would have to make a part of their whole treatment protocol, if you will. And so, and one of these things too is telehealth and tele-rehabilitation is it's a very popular thing these days, but it's also, the legislation for it is also up and coming. So the thing is that hospitals are trying to figure out a lot of times how to bill for it, and also how to get reimbursed for it. But the way which is okay for us, because physical therapists cannot bill for telehealth, but that's okay, because what we do is we make this pretty much as a part of their operational procedure, so that the therapist, they can use it as a tool to make their care much more efficient, and to also make it much more effective, so that they don't have to, if you're a patient and you're doing pretty well, and if it's agreed upon between the two of you that that you're okay to stay home and you're doing well enough, then great. You can just use telehealth visits to do that. But you can also use the telehealth visits to determine, like, hey, you know what? I'm not doing so hot. So why don't you go ahead and why don't I come in and get treated by you? So that's one other that's how we approach it. And I see here question: are you only working with current centers and diseases, or would you be open to try this with other diseases that look into physical therapy in their trials? We are definitely open to other diseases. But it kind of depends on what on what we can provide you right now, because as I said, most of our exercises are lower extremity in nature. The Kinect camera, the technology, does very well with lower extremity exercises, but as far as upper extremity, that still has to be explored. So if you were interested in something that involved more upper extremity, that would take a little bit more time, but we're definitely open to other avenues as well. Oh, there's another question: if this system was available only with a therapist recommendation, or can someone just decide to get it for themselves? So that's a great question, and how do I best answer that? So our application requires some type of clinical oversight. So if you're if a physical therapist prescribes this, or if a physician prescribes it, that's one way. If you were, another way that you could use this is as part of fall prevention, which is kind of how we've used it, how we've deployed it, and that's you still have someone that is overseeing the care plan, but you log in on your own time doing a fall prevention program, and then and then you do the exercise yourselves, but you log in any time, and then you can also progress the exercise yourself. That's one other avenue that we're exploring. But primarily, though, we are FDA cleared, and so we are cleared by the FDA, but as more of exercise prescription. So generally speaking, we need some type of clinical oversight. Okay, great. So I think that's pretty much it as far as questions. And so before I disconnect here, I should read this to you again, that the information and services provided by ALD Kinect and Reflexion Health are for informational purposes only. The information and services are not intended to be substitutes for professional medical advice, diagnosis, or treatment. If you or a family member are ill or suspect that you or a family member are ill, seek professional medical attention immediately. ALD Kinect and Reflexion Health does not recommend or endorse any specific physicians, treatments, procedures, or products, even though they may be mentioned on the site. Please note that your participation in this webinar is completely voluntary and that this webinar will be recorded and may be available for rebroadcast at a later time. And so if you guys have any further feedback for me or any other questions, comments, or concerns, you can email them to admin@aldconnect.org. Thank you all very much for taking the time, and look forward to hearing from you.